Okay, howdy everybody. Howdy. Oh, come on. They've taught me to do this, so you guys have to respond. So anyway, welcome. I'm really, really thrilled today to have Dr. Hotez with us. And before I get into his introduction that I have here for him, I just want to say that I first met him about a year ago. Not Is that better? It's better on my end. Okay, let's try this again. I hope all of you out there in Cyberland can hear me. But I met Dr. Hotez about a year ago at the Diseases in Nature Transmissible to Man conference, the Dr. Steele conference in Houston last June. And he gave the keynote address for the luncheon and just kind of brought it all together. Certainly talked about the tropical diseases, which I know he'll talk about today, but brought together, again, medicine, veterinary medicine, nature, and a very, very interesting conversation and lecture that he gave. So I introduced myself and I said, I've got to get you to Texas A&M. He said, well, I'd love to come. So this is the third in our series of 3 One Health seminars that we have. We have 3 in the fall semester and 3 in the spring semester. So this, of course, is our last one for the spring semester. So we're very, very pleased to have Dr. Hotez here today. So let me just tell you a little bit about Dr. Hotez. He is the Dean of the National School of Tropical Medicine and Professor of Pediatrics and Molecular Virology and Microbiology at Baylor College of Medicine, where he is also Chief of a new section in Pediatric Tropical Medicine in the Texas Children's Hospital Endowed Chair of Tropical Pediatrics. Dr. Hotez is an internationally recognized clinician and investigator in neglected tropical diseases and vaccine development. He leads the only product development partnership for developing new vaccines for hookworm infection, schistosomiasis, and Chagas disease, diseases affecting hundreds of millions of children and adults worldwide. In 2006, at the Clinton Global Initiative, he co-founded the Global Network for Neglected Tropical Diseases to provide access to essential medicines for millions of people. Dr. Hotez obtained his undergraduate degree in molecular biophysics from Yale University, followed by a PhD degree in biochemical parasitology from Rockefeller University, and his MD degree from Weill Cornell Medical College. He has authored more than 300 original papers and is the author of the acclaimed Forgotten People, Forgotten Diseases by ASM Press. Dr. Hotez serves as president of the American Society of Tropical Medicine and Hygiene and founding editor-in-chief of PLOS Neglected Tropical Diseases. He is an elected member of the Institute of Medicine of the National Academy of Sciences, and in 2011 he was awarded the Abraham Horowitz Award for Excellence in Leadership in Inter-American Health by the Pan American Health Organization of the WHO. So you can see we have a very distinguished guest with us today, and I know you will very much enjoy this talk this afternoon. So I'm going to try to get this over to you, Dr. Hotez, without it exploding.
So much. I very much appreciate that generous introduction, Dr. Chaddock. Unfortunately, we're out of time now because of it. Now, what I want to do in the next 40, 50 minutes is kind of give you a broad overview of this problem of neglected tropical diseases, many of which are zoonotic diseases, not all of them, and just kind of give you the big framework, the big 30,000-foot aerial view of these diseases and why we should care about them. And we call them neglected tropical diseases. Let me tell you a little bit about how this term came about. It's kind of a made-up term. It didn't really exist before 2004, 2005. And it came about because of, I write here, born out of desperation. What happened was in 2000, Kofi Annan, who was Secretary General of the United Nations, brought together all global leaders to United Nations headquarters and to draft these set of goals, which are known as the Millennium Development Goals. Has anyone ever heard of them before? Yeah, you know them, of course. And we'll see how this. Wonder if I should bring it further down here. Maybe that'll help. Brought all global leaders to the United Nations headquarters to say we need to do something for a group of people known as the bottom billion. It referred to the fact that there's about 1 billion, actually 1.2 billion people in the world who live on no money, who live below the World Bank poverty figure of $1.25 a day. And this was a renewed commitment by the United Nations to do something about it. So they drafted this document called the Millennium Development Goals. And I like to show it because unlike every other United Nations document that's forgotten about as quickly as it's drafted, this one is stuck and has provided an important framework that's been backed by a lot of global support, multilateral support, and real money. And it includes reducing child mortality, and this is what helped launch the Gavi Alliance, the Global Alliance for Vaccines and Immunization. Some important issues around maternal health and gender equality. Somebody finally figured out that we're going to need to do something about the plight of girls and women on this planet if we're going to address poverty. And then there's one that was specifically around infectious diseases, and that's number 6. To combat HIV, AIDS, malaria, and what they called other diseases. And this one was backed by multi-billion-dollar initiatives because it launched PEPFAR. Anybody know what PEPFAR is? Has anyone ever heard that term? It stands for the President's Emergency Plan for AIDS Relief. It's about $8 billion that you're paying for every year that goes to put people living in poverty in sub-Saharan Africa and India and elsewhere on antiretroviral drugs to treat their HIV/AIDS. And it also launched something called the Global Fund to fight AIDS. They added TB and malaria, which again is billions of dollars, both to put people on antiretroviral drugs, but also to provide anti-malarial drugs and bed nets, as well as direct observed therapy for TB. And so this is making a huge difference in the lives of the bottom billion, making this link between disease and poverty, showing that these diseases both occur in the setting of poverty and they cause poverty because of a number of effects that we'll talk about in a minute. And it also created a whole generation of what I call global health celebrities. Maybe you can tell me who some of the global health celebrities are that came about after this in 2000. Who are some of the beautiful people that we associate with global health these days? It all came out of that Millennium Development Goal number 6. Bill Gates, right? Absolutely. So the Gates Foundation really took off in 1999-2000. Who else? Angelina Jolie, absolutely. And if you get Angelina, you get Brad. So Brad did a 4-part series on global health and focusing on AIDS, TB, and malaria. Who else? Who's the big guy for HIV/AIDS? Bono, right? So Bono got involved in this, and so this also brought in a whole generation of young people whose interest in global health. So Art Kleiman, who's chair of anthropology at Harvard, tells me now 50% of Harvard undergraduates take a global health course, and so it's become a really hot ticket on undergraduate campuses. Now the problem for those of us who are not so much focused on AIDS and malaria but work on other diseases, the problem was they actually called them the other diseases. And you can imagine from over here, this is the pointer here, other disease. And you can imagine from an advocacy point of view and a public awareness point of view what a disaster that was, right? You're not going to get Angelina and Brad standing up there saying, now we're going to take on other diseases. And so those of us who work on other diseases, as many of you do here, I'm sure, found ourselves on the outside looking in on some very important global health initiatives. And so we basically a group of us, myself, Alan Fennick at Imperial College London, David Molyneux, Liverpool School of Tropical Medicine, got together and realized there's about 13 or 14 tropical infections that we just made up this term, neglected tropical diseases, or NTDs, just to provide a brand for this, because we noticed they had a lot of things in common, that they're highly prevalent among the poor, and I'll show you the list of the diseases in a minute, highly endemic, and especially in rural areas of low-income countries. You know the term emerging infections, like SARS or avian flu, and these are just the opposite. These have been around forever. You can find descriptions of these in the Bible, in the Talmud, the Vedas, the Quran. They tend to be chronic. They tend to be high morbidity but low mortality conditions, with a few exceptions. So many of them are not killer diseases, which contributes to their neglect, but they tend to be chronic and disabling. They cause growth delays, blindness, or disfigurement. And that made it very hard to message in a soundbite, but I'll come back to that in a minute. Many of them are disfiguring and highly stigmatizing. And this important feature that they cause poverty because of their impact on child development and growth and worker productivity. So I wrote a book about these diseases, which my kids like to call Dad's Forgotten Book on Forgotten People with Forgotten Diseases, but now it's in its paperback and it's in second edition. And it started to catch on, and now the World Health Organization